Okay. One other item of note, I just wanted to bring up why we are meeting in person today as opposed to virtually. Our commission has to approve a virtual meeting policy before we are able to meet virtually as a committee or as a full commission. And so we wanted to make sure that we had these discussions prior to the next full commission meeting, and then they will bring that policy forward for approval at the next full commission meeting, and then hopefully it's approved so that these committee meetings going forward can all be held virtually. So makes things a little bit easier as we get into the season of the weather that we will not talk about.
Yeah, I think in terms of meeting in person versus a virtual meeting, making as many opportunities as we can for people to be able to engage, whatever their limitations or preferences may be, making use of the virtual tools seems like what we would want to do, especially as we're looking for representation of voices on this committee, on the commission, and in our work from all corners of the county. And so I would be strongly in favor of offering virtual meeting options, especially for the work of the committees. The full commission we can talk about as a full Women's Health Commission the next time we meet or in the committee, but certainly the committee work can be very productive and inclusive, conducted in a virtual platform.
And I would say too to Commission Member Campbell that often with these busy schedules that all of the folks have, something can come up at the last minute. They can jump on a virtual option, but they can't make the drive time. So that's sometimes the limitation where they can make themselves available for 45 minutes, but it's the drive time. So very much looking forward to that. And thank you to the clerk for looking up all of that information.
So to the clerk, is there anything official that we need to do as members of the committee in order to put that forward?
At this time, it's being drafted by the law department, so they will make sure that it's all in legal standing, and we'll have it for you to review prior to the next commission meeting. Thank you for asking.
Wonderful, thank you.
And Madam Clerk, will we vote on it, or will it just automatically go into?
It will be voted on at the next commission meeting,
Okay.
yes. And then once it's approved, hopefully it's approved,
Okay.
it will go into effect.
Okay.
Okay, thank you so much. Now we'll get into the meat of hopefully the discussion here today is the goal of this committee is to discuss some initiatives that can be accomplished in 2025 related to the topic of physical health that this commission really wants to make sure that we are putting forward as we close out the year or begin the next part of the year. But hopefully there's something tangible that we can begin to put together for the end of the year. If there are ideas that people want to share about initiatives, thoughts on maybe some events, or I think there's been some discussion.
I'll, not that I can speak for Councilwoman Turner, but in her absence, I know she very much was in favor of their, the month is escaping me right now. A few months ago, in partnership with Metro Health Hospital, they put on an evening forum community event, very well attended, lots of attendees, and the discussion centered around fibroids and the health of as you move throughout the life cycle. It was very well received, so much so I think the meeting lasted maybe 30 to 45 minutes later than that was scheduled. No one wanted to leave. They had so many questions. And I attended, and we were sitting there like, wow, there's so much need and not miscommunication, but myths around fibroids. Menopause came up. So a couple different items, and we can check with her. I think they actually have reporting from we had to complete an evaluation at the end. So she has some detailed what people would like to hear about. So that can serve as a baseline for having these replicate. She has the blueprint. It's something, as I said, it was so well received and people didn't want to leave and they had many more questions. So I think, again, not speaking for her, it was a good idea as we talked about, even at the last commission meeting, maybe replicating those in 2026, 2, 3, maybe 4, but at least 3, in different parts of the community across Cuyahoga. So, and I know we have different elected officials that, in her mind, it was great because she could pull different players in different parts of our community. Not that it's just east or west, but south, east, west. And then different commission members could plan according to geography. This would include all women at whatever phase in their life around that issue, whether it's fibroids. We had at that meeting a variety of ages dealing with that issue. It was really a nice intergenerational discussion. So I, again, not speaking for her, but the idea of not dealing with 2025 yet, but 2026, this being something that this committee could take forward to the larger commission.
Thanks for bringing Meredith Turner up. She and I do talk a lot about her initiatives, which I can really appreciate. And Emily, my Leadership Cleveland partner, this weekend I had the opportunity to meet Janelle Vicks from the Hearing Speech Center. Now, for me, I have muscle tension dysphonia. And so as I'm speaking, I lose my voice. And so in my head, I said, for women's issues, it would be good to have community partners that we can rely on or identify with. So when you do have certain issues, you know the players that you can kind of pull into our initiative. So I think it's vital that we identify some of those community partners that could help us with our initiative. But also, as you mentioned, elected officials. We can always lean on them because there's something going on in someone's life and that they can speak to, like Councilwoman Nickerson. She also talked about fibroids, I think. So I think when we have those conversations with other women, they can actually give a little bit more insight on the issues, but it's important to identify our community partners to help us along with this initiative. And so as I'm speaking now, I am spazzing. So I'm going to kind of slow it down a little bit. And the other thing that I just want to mention is if you're not familiar with the issue or the condition, a lot of times people say, are you okay? Do you feel okay? Absolutely. I feel great. I work out 5 days a week, eat healthy, vegetarian, but the condition is there.
Thank you, Mayor Thomas. And I'll say one of the pieces that was so incredible was to have actual medical doctors in the room to answer the questions versus having just flyers. People were very vulnerable. It was a vulnerable time for many folks to share very intimate things about their lives. So a good place to have professionals there to really walk people through and a mechanism to circle back to people and connect them with those different entities, because this is something we never want to put information out and walk away. To make sure the appropriate people are there to answer questions and connect them to care, whatever they need.
Dr. Big, one of the other things that Janelle brought up was support groups. So you never know who's going through the same thing you're going through, and I never heard of a support group for muscle tension dysphonia.
I think that's a great idea. A lot of, in pediatrics, there are a number of support groups for families of kids that have specific medical conditions, and that sort of a kind of community building seems very helpful, at least in the peds world, and so I think that's a wonderful idea. Did you find a support group for the dysphonia?
Not yet.
Not yet.
So yeah,
You should start it.
But you know what? Janelle said there's many support groups out there. Have you found one yet? I was like, no, I haven't. I haven't been looking. But I'm for sure. I'm going to talk to my assistant, and we'll definitely find one or
Awesome.
find a couple.
Yeah, that's great. I think having you in, if you do find one, I think having you in one of those groups would be really empowering for people to see, look, I'm a mayor and I'm dealing with this. It's clearly not holding you back, which is awesome.
As women, we are fighters, and so we don't let anything hold us back. Our action speaks louder than our words.
Yeah, absolutely. I was just thinking of a couple areas of healthcare that might be important if we're thinking about topics. Like postpartum complications. A lot of women die unnecessarily. And we could, especially teaming up with Birthing Beautiful communities in our hospital systems, having some kind of like an educational forum about maybe for women who are expecting or just people in general in the community, so there's more awareness of, if you had a baby 2 days ago and now you have a bad headache, that might be a medical emergency. Those kinds of things that sometimes we'll sort of pass off because we're trying to get through the day and take care of our new baby, but really, your body's trying to tell you that you're in trouble. So something like that, or cardiovascular health for older women. I know that, when we think about women and women having heart attacks, the signs are so much more subtle and kind of helping people have a better understanding of, what could be a sign of a heart attack. And also like how to communicate those symptoms to a medical professional. Because I know it's different from the peds world, but I will often tell my patient families, like if you end up in this situation and you have to go to the emergency room, these are the words that you need to say to get their attention. Not that you're being dishonest or anything, but you're not toning down the symptoms. These are my concerning symptoms that I am having. This is, just making sure that people are armed with like the language to help them get the attention that they need, especially I think for things like older women with cardiovascular issues or, so anyway, just thinking out loud. But I love all of these ideas.
So a couple of thoughts that are running through my head. First is that there are a lot of issues that women across their life cycle face that we don't really talk about, that are hidden or that are in the shadows. And I'm thinking back also to the presentation we had at the last commission meeting about period poverty and some of the shame and embarrassment that holds women and girls back from getting the help they need, the support they need, or thinking that they're the only ones dealing with those things. If our group of members of the Women's Health Commission came together and brainstormed some of those things, I bet we'd come up with a list that we could do something every month on a particular topic that's hidden or that there's a lot of myth and misunderstanding around within the community. And so I would love to see this committee focus some of our attention on those particular things that we don't hear about all the time, and that people in our community are suffering in silence and loneliness, where some coming together as community could really make a difference to provide that information. And to Dr. Bean's point, issues where after something happens, you hear from patients or others, I wish I had known ahead of time because I would have done something different, not waited so long, whatever it may be. But I think those are the kinds of health conditions and health issues that this commission can focus on and highlight, representing women throughout Cuyahoga County. And I'm in full support of removing the reproductive word from the committee name, but want to acknowledge that a lot of issues that are special and particular to women are the physiology, reproductive health related specific things to people who are born as female. And so while we think about physical health, and this gives us a broad and wide latitude to go in a lot of different directions in these early days as we're starting out, making sure that we keep women's as the emphasized word in Women's Health Commission. And reproductive health, as we've talked about, is a great way to do that. Even cardiovascular health specific to women is a very important piece of it. And so having an element of information sharing, good information sharing, myth busting, questions answered by trained professionals, community building, and calling attention to issues are, I think, the three objectives that we could put forth for public events hosted by this commission.
And, no, go ahead. What I think, and this is just my thought, we landed here because of reproductive health. And so we won't forget that. And we'll keep that on the forefront. However, physical health is, it's going to encompass everything.
So to maybe change the subject a little bit, or come back to our subject of 2025 initiatives, I know that I was looking it up because I couldn't remember, but next month is Breast Cancer Awareness Month. And so I wonder if there are opportunities for this commission and this committee to tap into things that are already being planned within our community, or to elevate some things in different ways, that could be a way for us to begin to call attention to the fact that we exist as we're planning for larger sort of self-contained or events that the Health Commission is a marquee sponsor of or pulling together over the course of the next year. And so perhaps we can give some thought to where those opportunities may lay, within the next 90 days or so as we head into the next month for breast cancer awareness.
And then it could be something as, all encompassing as making sure everybody's wearing pink on a particular day for county employees and others, that we're standing behind all that. That's not small, but then working up in all that you said, Emily. There's
Great.
so many opportunities.
Yeah. And focusing, breast cancer is not one of these things, but fibroids are. Yeah. Focusing on areas that aren't perhaps getting as much attention as they certainly deserve and as they need to in our community, and hearkening back always, because I got to go back to the data and remembering the presentation that we received from Enlightened Solutions on Project Noir about the experiences of women. So perhaps if we are to pull together something for breast cancer awareness, have a little bit of a different focus on perhaps patient experience or on caregiving. November's a National Caregiving Month, but to take a little different approach or tactic than others have, and to really center the experience of women in our community in all of the things that we do and bring forward. I'm glad we have a clerk to get that all down.
The other thing I think is crucial at this time is all the cuts that's taking place. And so access to health care is going to be the biggest challenge.
Yes, absolutely. We're operating in a tough environment here. Mm-hmm. And especially as we think about some of the things coming over the course of the next year in terms of Medicaid and new work requirements for the expansion population, there are a lot of women and families that will get caught up in some of these challenges. And so ensuring that we're doing all we can to help people keep the benefits they're entitled to could be another avenue.
In the short run, for 2025, this is all wonderful, starting to plan through 25 to set up for 26. But to go back to the period poverty, Commission Member Campbell, to really take that information, and maybe it's that we do another drive before the end of the year, in November or December, and bring back our good friend Katura and set it up from this commission, do a drive, and maybe possibly, I know, yes, do a drive and maybe provide some funding for that work being very targeted. So, and we can defer to the Center for Community Solutions on how that looks, but put a stake in the ground on that work that Katura, for those of you who may remember, she was a Cleveland Foundation Fellow and spent time with our Health and Human Services Department here.
Yes, and I want to add in some partnership possibilities as we think about this. When I think about period poverty, I also am going to bring a little of my personal into the room here. I have a daughter who's in middle school, and school policies about breaks and restroom are not always conducive to young women being able to take care of their needs during their period. And so I think there is an opportunity for us to look at some policies or identify some best practices, some of our school districts and schools here in our county that are doing this well, and encouraging others to consider those things. You know, balancing, I understand schools are balancing safety, but I know that there were some young women in Cleveland Heights University Heights School District that did some amazing advocacy on their own behalf, asking administrators to change some of those things to make it a little easier for them, and were successful. And it was truly it wasn't top of mind for the administrators, nothing nefarious there, but when it was brought to their attention, that's an opportunity that could be done fairly quickly. And then the second thing has gone out of my head, but it was brilliant, about period poverty.
It'll come back.
It'll come back.
But that's great. School, so a policy piece, an actual do something piece,
Something
a drive.
Oh, I thought of it.
Okay,
Thank
okay.
you. Thanks for riffing while I remembered it. There are new opportunities for healthcare services within schools, and so ensuring that those healthcare services going into the schools have those supplies on hand, and making students aware that if they need those supplies, they are available in those health centers, could be, where the donations go to, or sort of what we think about. Because I just think my heart goes out to young women that are trying to navigate these things early in their cycles, and figuring things out.
And this goes back to our wanting to make sure we touch younger women and reach all across the spectrum of age.
I just wanted to echo that as a pediatrician, I absolutely love these ideas. And I wish I was joking that I once wrote a letter for one of my patients, giving her a medical, actually I probably did this more than once, but this particular patient saying that she could use the restroom when she needed to use the restroom. And I just thought, gosh, what a ridiculous thing that I have to write this note for you to be able to use the restroom. So yes, I think awareness of sometimes people need to use the restroom and you should not argue with them is just, obviously a wonderful idea. And then another thing to the providing supplies, I don't know if this quite makes sense, but when I will talk to girls that are around the age that they're gonna maybe start their period and just having those conversations in clinic, sometimes I'll suggest to them, well, it always helps to be prepared. So just make sure you have a little pack of pads in your backpack, and and you might not need it, but your friend might, and you're going to be somebody's hero if your friend starts their period at school, and you can help them through that. And so I think I love the idea of having more supplies at school, but also just maybe even getting it into the kids' hands so that they can be there for each other when they're feeling nervous.
I love that little emergency supply pack idea.
Yes, I also love that. We could maybe provide little emergency menstruals with a, yeah,
With a note.
yeah, for the kids, I think would be really great.
Okay. No, go ahead. No. So what I'm thinking about is community base. As a mayor, we have the Mayor and Managers Association. And so the great work that we do and all the initiatives, it would be good to share that information on or in a municipality or in their e-newsletter. So we connect with the schools. So now when young girls try to figure out where to go for support or information, it's right there for them. So we can be that resource.
So to the county representatives here, what might be some next steps, or where we have a lot of great ideas, the action and activating those ideas. Where do we go from here?
I think once the clerk pulls the notes together, there'll be just a reporting back to the larger commission. I think, as you all have said, landed on basically the two components, period poverty, and then the planning of the 2026 forums. I think, again, not to speak for Councilwoman Turner, that whole menopause, fibroid, whatever the topics are, I think everyone on the commission can weigh in, but just decide as this smaller committee in our next virtual meeting, what we're gonna lead with, what topic, top of 2026. So presenting the two components, rolling them out, and then the period poverty, I think there were the policy piece that this committee can continue to work on, a product drive by the end of the year. That's something, by the end of the year, begin the conversations with schools. Maybe that's something through 2026 with many different districts and mayors and managers meeting, and then to roll out the information. But this piece around partnering and supplies in these different schools, that can be through 2026. But something very concrete right now to launch would be maybe we get a few supplies where we pay for some kind of emergency little packs that we distribute on behalf of the Women's Health Commission, Cuyahoga County, and then doing the period poverty drive in connection with Katura and any other group. So that's the actionable something right now. Take that back to the commission to vote on as the commission, and the detail will be in the, I don't know when the next meeting is, clerk, but the October,
Whenever.
no, the next committee meeting. Virtual, in order to make sure this happens in November or December, I guess it would be October virtual meeting.
Sure.
So,
And perhaps we could ask Katora to join our next committee meeting as well,
Yes.
because she has been thinking about this issue for a long time, and I am certain there are things that she would love to do and see and bring from other communities that have worked well. So if we could lean on her as, and lean on her expertise to try and activate something that perhaps she would love to see in our community or wanted to do but didn't have the whatever to do it, that the commission can support her work as well and recognize her role in particular in bringing these issues to light. And in terms of distributing those emergency packs, I would love to encourage us to start with those in school health clinics.
absolutely,
The partnerships are already there,
absolutely.
and I know the schools are working hard to ensure that there's not stigma and some other things for students that do utilize those services. So it's like, they're already there, they're already in front of students, they're already talking about healthy lifestyles and health.
And you, as you said before, she would have information drilled down on many of those districts. I mean,
Totally.
some may be better prepared than others.
Probably has it already.
Yes,
So
so that would be
let's not
turnkey for
invent-
us, yes.
let's not invent what
Yes.
someone has already put the effort into.
I just love the idea, starting with our young people, getting these packs together and starting a drive. That's something doable that we can
Yep.
meet one more time and with Katura's help, of course, and then execute in
Absolutely.
November, December.
Absolutely.
A perfect time of,
And gives us the
giving thanks.
opportunity to think, as we think across the lifespan, you know, we have done something focused on young people in particular, although, you know, period poverty is not something that only impacts young people.
Absolutely.
But if we take that slice of it, then that also gives us the opportunity for some of our planning into the next year to focus on other parts of the lifespan.
and there may be some unhoused opportunities
sure.
too,
Yes.
to make
thank
sure
you.
we're, targeting
Mhm.
whoever might need this the most.
Yep, and our friends at Greater Cleveland Food Bank and others.
Yes. So,
Yeah, lots of tapping into things that may already be happening
Yes.
and uplifting them and boosting them in ways
absolutely.
is great. Thank you.
Is there anything else, anyone? We still have 10 minutes if there's any other topics of discussion.
I would say, I mean, we don't have a chair of this, and it'll be more of a just nights or nights around the round table. But I think we do need someone to report back.
Yes.
I see I'm being stared at.
Well, only
no, I'm
be-
happy to do it. I'm happy to do
No,
it.
only because you're directly across from me.
Oh, okay.
I mean, that would be weird for me to turn. I'm only- There's only one way to look. It's one of you.
I'm happy to do it, but also happy to defer.
I think you would be great.
All right, fine.
I love this because everyone had input.
Yes.
We're taking what Councilwoman Turner felt so strongly about, so I appreciate the dialogue.
And spoke to us so passionately about it our last commission meeting as well.
And we have a plan.
Well, this is what happens when you get a bunch of women in a room.
Yes, ma'am.
Get stuff done.
The next committee has a heavy lift ahead of them to
Mm-hmm.
come with it, so.
As we think about our next committee meeting, it sounds like we'd like to aim for October. It will be virtual, pending any approved virtual policies. Are there like times of day that people prefer, or is it okay if I just send out sort of here's a couple of times, let me know what works, and we'll go from there?
All right, the morning works for me, but I am flexible.
Great, that's helpful. We'll put a couple of times together in a smattering of morning and afternoon, and hopefully morning works for everyone else too.
Well, morning, when I say morning, 10, 11. So,
Cool.
yes, not 8 or 9. No, 11 works.
Yeah, this time is great.
Oh, great. Okay, wonderful. Okay, well, keep an eye out for that then. If there's no other business, I guess we can adjourn for today and give you a few minutes back this morning. All right. Thank you all.
Productive meeting.
Thank
Thank
you.
you.
It was a great